Good afternoon, ladies and gentlemen. My name is Piotrak, and together with Tomasz Suchocki from our partner company, JT&T, we'll speak about the migration of records from one of the hospitals in Poland to the Oracle Cloud. During the past few months, we've observed a very dynamic process of speeding changes on the IT market. We expect our presentation to take 15 minutes or so, and during this time, many companies, 15 or more, will make a decision to move into the cloud. So we need to be flexible, as the current situation requires a majority of companies and corporations to think of the way out of the pandemic-related crisis. And they are also preparing their contingency plans for future crises. This is why they invest in IT resources. They want to plan for future scenarios, including any potential future lockdowns. They need to be able to be very flexible in how they use their IT and ICT resources. And this is what we can help with using our Oracle Cloud. The second very important matter is security. Security is an absolute priority. Everyone is concerned about leaks of data, about human errors, and that would compromise credibility of these companies. And we agree with this. Security is very important for us. We are the only provider of autonomous database in the cloud. All this is managed by artificial intelligence, and we want to eliminate human errors. Most of the cases when data leaks are observed are due to human error by way of wrong configuration of database. This system corrects errors by itself, it updates itself, and this automatized system limits the possibility of human error and increases the security offered by our cloud. Oracle offers public cloud of the second generation with many services related to infrastructure and software. This is a complete environment in which applications can be launched. It is fully secure, it does not slow the system's operation, and even more, it has a very clear information about costs. So the costs, the fees for the cloud are very transparent. It's very easy to assess them and to foresee them. This is all from me, and let me now give the floor to Tomek, who will speak about the practical example of such an implementation.
Dzień dobry, witam.
Good afternoon, Tomasz Suchocki. I oversee a company which for 20 years has been providing IT services to Polish hospitals, and I want to focus today on one of our recent achievements. As we all know, the healthcare market is going digital for years, and we are supporting it by implementing new solutions across Poland. We are introducing electronic medical records. We are launching regional and nationwide platforms and services, and as a result, hospital IT systems need very quickly and lots of resources, software essential to support this infrastructure. It's not the only thing that is required. You also need staff, trained staff, safety, reliability, to work around the clock to ensure comfortable working conditions for employees. Hospitals have been buying new equipment for several years. They have been putting server rooms to expand their IT systems. Later, they have to maintain the infrastructure, safeguard it, and when the warranty expires, it all begins anew. And this is the challenge faced by the hospital I'll be discussing today. After a number of implementations, it had to set up a new server room, not only to keep servers, but also to provide working space for IT people. So that involved a number of investments for construction works, for fireproof measures, support that would guarantee swift services if anything happened. And of course, licenses had to be purchased. My company, from February this year, has been supporting this hospital. We are overseeing Aseco's Firma Medica system since February. And because in addition to the central building, where the server room is fitted, the hospital has several minor locations. Because of location and bad connection with the main hospital, the old inefficient server was inadequate. It wasn't fit to support new functionalities that were introduced at the hospital. Several months later, when we earned the trust of the hospital, its management began to openly discuss development of the server room. It was a massive investment for the hospital, as it is for any other hospital. So we've suggested that instead of building a server room, they can rent it. They can migrate software to the cloud. We are a partner of Aseco, software developer, and we are also a partner of Oracle. So we suggested Oracle Cloud, I think the best solution in such circumstances. This led to a number of questions and challenges that had to be addressed. Well, main issues reported by the hospital was continuous access to data, 24 hours a day, 7 days a week. Later, storage of data within the European Economic Area. Of course, these data could not be transferred elsewhere beyond this area because they had to meet and comply with all requirements set by regulations and the Minister of Health. Data encryption, personal data protection, safety and security. So there were many fears that we are also anxious when faced by something new. We had to address a number of issues we have never encountered in 2 decades of our operations, and many meetings later, also meetings with software supplier, with supplier of cloud-based services. We have managed to overcome objections, and the hospital announced the tender for migration of its systems to the cloud. We were chosen as the service provider, and we provided Oracle Cloud. When the contract was signed, we got on with work. We had just 10 days to complete the task in the new reality. So when the infrastructure was designed and the infrastructure included a number of servers as a matrix, a modern server room tailored to the needs of the hospital was set up. Of course, hospital is the only entity that may access it. Access is encrypted and safe. After several trials, we could go live with transferring the system to the cloud. So the hospital system was turned off for 1 night, and in the morning we were ready. And of course, there were fears, there was anxiety. We did not know how the system would operate under high load. We were sure that servers are swift, they have adequate memory as the disks. But what could pose a problem was internet connection with administration, which was located further away and used old hospital infrastructure, or connection with external systems. But we trudged through, code with individual problems, and the first visible change was much faster operation of the system, what means that hospital could work much faster. There was no difference in the speed between the main building and other locations of the hospital, despite the fact that the internet connection at one location was 10 times slower than in the main building. So right now, the location is connected with Oracle server room in Frankfurt and not the hospital, which is located 10 kilometers away, and all operations are performed on very efficient modern equipment. For example, the system is able to work much more efficiently and faster. Time needed to provide services to the patient was reduced by 1/3. The hospital is no longer afraid that the old equipment will let it down one day. Local IT people are no longer taking phone calls in the middle of the night that the system crashed. Access to services is now unlimited and safety is guaranteed. So right now, 7 months later, we and our customers, we agreed that we took certain risk, but it was a bang-on decision. The hospital is up and running and it's operating smoothly using Oracle technology. We are monitoring its server room 24/7, and we are alerted every time when efficiency of the system declines. IT people from the hospital have unlimited access to the server room, and we cooperate with each other as we go. We will be overlooking its server room for another 4 years in line with provisions of the contract, but the customer has a guaranteed price while the agreement lasts. It's not a big cost. Annually for all services, they spend as much as they would have to spend to buy a single server. Obviously, the hospital is not paying for bills. The payroll for IT administrator is not paying additional costs, even if we have to expand the infrastructure when all medical records in the hospital is converted into electronic format. Oracle Cloud is a very flexible solution packed with tools, and we are able to expand, refurbish it online. I've never seen such great economic and flexible cloud-based service before. I'm very happy that we have a first hospital in Poland that moved its server room to Oracle's cloud. No one wanted to go first, but they have paved the way. I'm sure until the end of the year, we will have new implementations on the record very soon, and the hospital will be benefiting from the service, followed by others, hopefully. Thank you very much.